Alright guys, so here is a case. We're going to do a full double arch real quick. It's take about 10 minutes. This is about on 3x. Patient is completely dentulous. Whenever I see an edentulous, I always take the opportunity to take my Elman and I go ahead and I create my flap mid to palatal crestal. And in this case, because I felt comfortable with the sedation that the anesthesiologist was taking care of, I did the full flap in one shot. Sometimes I do it in sections, but I mark where the distal of the molar is going to be with my surgical guide, where's my wax up, and then I go ahead and I lift. Alveoplasty done here is just to have a nice flat area. You can see I'm not doing that much. There was a little bit more resorption in the posterior than there was in the anterior, so we go ahead and we fix that. So in the maxilla, first thing I do is I find my depth, and my typical sites are 3, 5, 7, 10, 12, 14. You can see I fell a little bit there, so I go back to 7, go to 14, and then split the difference for implant number 12. Then in the maxilla, we do everything with densiburs, unless it's extremely dense, backwards at 1200 RPM. We go down to depth. If we have to do a sinus lift, we go a little bit slower to the sinus floor, and then we go ahead and go backwards and lift it. Here we go, backwards. This is about a 3.0. It was a little bit too dense, so I went to the depth specific drills in that area, and then you can see this is going nice and backwards, densifying the bone so that we have great stability when the implants go in. The pumping motion of up and down, a lot of irrigation because the flutes will get clogged. Making sure to control my angulation as best as I possibly can. The arch was segmented before, so I kind of in my brain know exactly where the angle of the maxilla is. Here we go, Megagen AnyRidge implants. As long as the implant gets stuck 75% or less, then I feel comfortable not having to take it back out. These are all torquing out at 80 Newton centimeters. And then there we go. 6 implants are placed. Torque wrench is placed. I place about 1 millimeter subcrestal. Multi-units are placed 25 Newton centimeters. In this case, in the posterior, we did straight implants. I try to stay as straight multi-units as best as I possibly can, because I really dislike angled multi-units the way they hold the prosthetic screw. But these are 17 degrees in the front. We go ahead and we put our 2-PEL photogrammetry markers on. My assistant is doing this while I am calibrating the 2-PEL, or the Blue Sky Bio Grammy. Make sure that you always clean off the scan bodies, because if there's blood, the scanner won't be able to see them really well. And then we go ahead, we take our little 2-PEL, we angle, and we go. This is a great video showing the beauty of how the THS caps work. The gold ones are 2 millimeters, and it really allows us to position the tissue where we want it by keeping the keratinized tissue buccal and not moving it all completely to the palatal, so that when we take our scan and design our prosthesis, the tissue will stay there. It also creates a beautiful, a little bit of pressure so that you get nice hemostasis, so that when you do your soft tissue scan, there's literally no bleeding. Fluorochromic sutures. Another THS cap right there. Trails 4. AI is off. Edentulous mode. Scan body mode. XCELL jig is placed and removed. And now off we go to the lower. We set the guide so I know the distal of the molar. We make our incision, make sure the patient is nice and numb. I try not to give a block in this area. Periosteal elevator. I try to make a really small flap so the patient is not in much pain. Again, get rid of the small peaks just to slightly make sure that everything is nice and straight. Drill the molar. Find the mental nerve. Make sure you're behind it. Positions are 19, 21, 23, 26, 28, and 30. Drill the molar. Split the difference. Make sure you're in front of the mental nerve. Densa if you feel like it's low density. If not, you can use Densa forward. But these are blue diamond implants. You can see how fast they're going in. They don't really get stuck. Also torquing out at 80 Newton centimeters. These are 4 1s and 3 3s. So RC and NC. Multi-units are placed. 25 Newton centimeters. 2 PEL. And now in this case, because the tissue is much thinner, we'll use a THS 1 millimeter. Move the tissue to the buccal. Use the THS to help you do that. And create hemostasis all at once. THS placed. These are placed at about 5 to 10 Newton centimeters just so I can get them out and they don't fall down the patient's throat, obviously. Trios scan, Trios 4, intraoral edentulous scan, AI off. Lower XCELL device with some THSs exposed. Bite registration and XCELL device registration all done. Then we go ahead and we design. Takes about 10 minutes to design, 12 minutes to print with the DentaFab. Take off the THSs. You can see there's really no bleeding whatsoever. Deliver the screw retained prosthesis. In this case, we use Powerball 1.0 because it's just much more forgiving in the printed temps. You can see how it goes in really fast, really quickly. This is torqued to 15 Newton centimeters, no more, no less. Take off the THSs on the lower. Flexera Ultra Smile Plus. And then we do a small bite adjustment to make sure he has no high spots. Most of the high spots you see are from the supports. But in general, it looks pretty good, I think. Small adjustments. And that's it. Bite is perfect, fit is perfect, surgery looks great. And this patient will do really, really well. We placed 12 implants. The whole procedure took about 2 hours with the printing and the designing, all done by me, yours truly, with my team.